Hi, so I have gotten lots of questions that has about itching and watery eyes and dry eyes, and yes, I've done a lot of work on itching, but most times it has to do in combination with other topics. So today I want to talk about itching. Okay, so when you are experiencing itching in your eye, it could be as a result of a couple of things. Number one, which is the most common reason, could be as a result of an allergy. Right, when you're having an allergic reaction, your eye kind of itches you. You have this urge to always scratch your eye, maybe which is because you are reacting to something, and that something you're reacting to could be an external factor, it could be an environmental factor, it could be due to season. Right, so now if it's an external factor, it could be that you're reacting to your cream, your soap, your detergent, maybe insecticide, whatever thing that just happened. So what I usually tell my patients at that point is to note when they began to experience the itching, and then think back like a week before that time, a week to 2 weeks, if there was any change, if they changed anything in their skincare regimen or around their houses, and if this has to do with your child. If it's your child that probably you're breastfeeding mom, or you're carrying a baby, your baby could be experiencing this itching as a result of what you did to yourself. Because you're always carrying the baby, if you use detergent to wash your clothes, and that's the type that the baby reacts to, then he or she will start having the itching. So that has to do with external factor. By the time you identify and eliminate what is causing that itching, right, then the itching will stop. What you are reacting to, then the itching will stop. So when you go to the clinic and they give you a medication, they give you an eye drop which you use that will stop the itching, but if you are still exposed to that same thing that is causing that problem, the itching will always come back even after treatment. Now, if it is due to an environmental factor, it could be based on where you're living. If you are living beside a factory or a company or an industry that brings out certain fumes, right, that your body does not like, you're going to also experience itching. And as long as you're in that environment, you will always experience this challenge. Now, it could also be seasonal in the sense that it could be maybe some people experience itching mostly during dry season, or as we're about to enter dry season, when the dust, the pollen and all that are there, when they're all in the air. So you find out that during that time they're always itching, they're always scratching. Yeah, so basically what we do at the clinic is that we prescribe either antihistamine eye drops or a mast cell stabilizer, depending on what the challenge is. If you are given an antihistamine, immediately you're going to, and both of them works very well. All right, so but if the itching keeps recurring, then you have to identify and eliminate whatever it is that is causing the itching. Also, certain refractive errors can also cause itching. If you are an astigmat, if you experience astigmatism, it can also cause itching, most times in one eye, rarely in both eyes, but it's still possible. So if you are an astigmat and you're always having itching, even if they give you eye drops, the eye drop will just grant you relief a couple of days, couple of weeks, but the itching comes back until you take care of that refractive error. So if you're having itching, first of all, I'm going to suggest that you go to your optometrist, your eye care provider, let them identify what is causing the itching. Is it due to allergy or is it due to a refractive error? Either way, let the right treatment be done so that you stop struggling with that. Now, if you found value in this, don't forget to share this, and then don't forget to subscribe. Subscription should be here. All right, I'm still trying to figure out all that. So you can see I'm doing this in my car because of the questions, so I just have to get it done and get it out there so that you can actually watch and learn. Most importantly, do not try to don't try to always scratch, because when you do, you are transferring germs from your hand, from wherever you touch, from your hands into your eye, and that leads to infection, which is why some of us have these discharges. Okay, so I'm going to talk about discharge on a different day. So I hope you get value from this.